Good afternoon, all the students, lecturers and CEE members. Okay. Today's topic is typhoid. Typhoid. I think you all have known something about that, right? What is typhoid? See, I mentioned two pictures there. How does it look like? Huh? Very sick, yes, of course, very sick. And look at his face. How is his cheeks? Very shallow, right? Why it is happening like that? Diarrhea? Yes, of course there can be diarrhea because of typhoid. And then any other causes? Fever. If you get fever, you will get shallow cheek? No, right. What can be the other causes? Usually, if you get typhoid fever, you have to avoid taking solid food. And your appetite is lost. You don't want to have anything. It is not only one day. It will take a week, sometimes 10 days. You cannot have anything, just liquid diet, soft diet only. If it is happening like this for a long time, the patient will be like that only. Very thin, emaciated. And then you see here, this is the bacteria. Typhoid is actually caused by bacteria. What is the difference between bacterial disease and virus disease? Which one is easy to get cured? Bacteria, of course. Antibiotics are useful for bacterial disease. Here you will see long cylindrical shape, that is the body of that bacteria. You will see these noodles-like string. This is also attached to that bacteria body. By that, this bacteria is moving along the bloodstream from one organ to another organ. Then it can spread to your whole body. Okay, let's see. Next slide. Long ago, people believed that typhoid is very difficult to get identification, very difficult to get cure, and they assume it is the smoke disease. That was ancient time. How is it affecting our world? According to WHO, it infects roughly 21 million people every year. It is killing 200,000 to 600,000 people each year. Lethal. Out of them, nearly 2/3 is from Asian countries. We are living in Asian countries, so we have high tendency to get typhoid fever. How about Malaysia, your country? Over the past 5 years, out of 100,000 population, 0.39 to 1.95 cases are detected. You will think it is very, very small number. Actually, it is based on this number of population. If it is focused on the smaller population, then this amount will be bigger. This is the latest update. In August 2015, 55 typhoid cases are recorded. Among them, 37 were from Kuala Lumpur and 18 were from Selangor. I think most of you are staying in Selangor state, right? So you still have many chances to get that disease. Luckily, all these patients are in stable condition no deaths have been reported. So it means it is manageable, still manageable. Okay, let's see how is it caused. It is caused by bacteria, not by virus. No, this kind of bacteria. Name of the bacteria is Salmonella typhi. See, it is ended up with typhi. That's why we call the disease as typhoid. There is also another similar species. It can give similar symptoms. Salmonella paratyphi. Main bacteria is this one, Salmonella typhi. We humans are only species affected by that bacteria. There are no animal typhoid, only human typhoid. Okay, it is spread by injection of food or water. This food or this water is not a clean one, contaminated, dirty one. Contaminated with excreta, contaminated with stool from an infected person. Infected person is sometimes apparently looking healthy. Some infected person already showing symptoms. Some are looking quite healthy. Which one is more dangerous? Healthy person or unhealthy one? In medical point of view, people are looking healthy, but they are still infectious to other people. These people are very dangerous. We cannot identify easily in our community. They are looking quite healthy, so we believe they are healthy. Actually, they are shedding all these organisms. They are spreading infection from one person to another person. So this kind of people are very dangerous. It can be among our environment. So you have to be aware about that. That's why typhoid is very dangerous. And then, once bacteria comes into our body, it will go along our intestine. Intestine is cut, our intestine. And then there are some lymphoid system along the intestine. They will multiply in that area. See, this is the Salmonella typhi bacteria. You will see all this flagella. Under microscope, it can be seen like this. Okay, how it causes? Bacteria spread throughout the small intestine, and then they will travel through your bloodstream. It is carried by the white blood cells. They flow along the bloodstream and enter into the organs. Multiple organs it can go into. In that organs, it will multiply and then travel along the bloodstream and it will reach to another organ. So whenever the bacteria enters an organ, you will get signs and symptoms. You will get fever, you will get headache, you will get diarrhea. So once it enters into liver or spleen, then you will get all these symptoms. And if bacteria is entering into the bloodstream, you will get similar symptoms. Okay, let's see what are the symptoms. So, the most common symptoms are headache. Because of fever, you will get very severe headache. Poor appetite. You don't want to have anything at all. Fever quite high. You will feel very weak, lethargic, loose motion, diarrhea, sore throat, abdominal pain, abdominal discomfort. Some symptoms are quite similar to influenza, right? So, if you get similar symptoms, you have to think about typhoid also. Normal tongue, what does it look like? See your tongue. How is it? Color. How about the color? Green. Red? White? How is normal healthy person tongues look like? Red color, right? Moisture there, It is not dry. But if you get typhoid fever, your tongue will be like this. We call it coated tongue. It is wearing white coat, right? See? White patches in the center. And smell is not good also. That is one of the symptoms. So if you get fever, don't forget to see your tongue. And then there can be fever, 39 to 40 degrees Celsius. Skin rashes can occur. We call it rose spots. But it can be seen only on the second week of the fever, not in the first week. You got fever, after sometimes only in the second week, you will notice some red spots over the body, especially over the chest and the abdomen. We call it rose spots. You are not treating, you think you are getting influenza only. Then what will happen next? Your bowel, your intestine becomes inflamed. You are keep on eating solid food, nasi lemak. There can be irritation along your gut. Your gut is swollen and inflamed. Walls are very soft at that time. That time you are eating solid food. What will happen next? There will be hole in your intestine. We call it ulceration, ulcers. Not only one ulcer. This is the characteristics of typhoid ulcer. You can see along the intestine there will be many holes. So this is the most dangerous situation. Not only that, there can be inflammation of bones, weight loss, inflammation of brain, we call it meningitis, inflammation of joint, arthritis. Once you recover from the first attack, don't be happy too much. There can be second attack, third attack. Some disease like measles, if you get measles in your lifetime, one is sufficient. You will get lifelong immunity. But typhoid is different. You still have chance to get next attack. Okay? As I mentioned, typhoid bacteria only live in human beings, not in animals. Persons with typhoid fever carry the bacteria in their bloodstream and intestinal tract. Among them, very few numbers, very small number, they are recovered from typhoid, but still they are carrying bacteria in their body. They are looking apparently very healthy, but still infectious. That kind of persons, we call them carriers. Carriers. These are the dangerous group. Both ill persons and carriers, they are shedding Salmonella typhi in their stool. When can you get typhoid? If you are having food or drink beverages, it has been handled by this person, then you will get infection. If your food is handled by infected person, then you will get that disease. Food is contaminated with stew, then you will get that infection. Once bacteria are eaten or drank, they multiply and spread into the bloodstream. They will travel along your bloodstream. That time you will get fever. Once bacteria is in your bloodstream, you will get fever and other signs and symptoms. This is the main point here. Original infection doesn't provide immunity to subsequent infection. If you get first time attack, don't think you are protective for another attack. Still you are weak, still you can be infected in the same intensity. So you have to be aware about that. Even though you get infection for the first time, you still have chance to have another infection. How can this disease be diagnosed? Usually we diagnose through stool culture because bacteria is staying in your stool. So we have to get stool and then culture, then we can identify Salmonella bacteria. If a test result isn't clear, then blood specimen we have to get. We need to check our blood. One good news is it is treatable. It is bacterial disease, that's why antibiotics is effective. Usually we use chloramphenicol. With appropriate antibiotic therapy, there will be improvement. Within a week, sometimes it will take for 10 days. So typhoid is actually preventable. No need to worry too much. There are two main things you have to follow. One is, please avoid risky foods and drinks. Second thing is, you need to get vaccination against the typhoid fever. I put this first. This is second line. Because if you are avoiding risky foods and drinks, you are also preventing from other foodborne diseases, not only from typhoid. Isn't it? Vaccination. If you are vaccinated, how can you prevent the disease? It is not 100% protective. Not only typhoid vaccination, all vaccinations are not 100% protective. It can give certain guarantee only. Maximum will be 80%. So even though if you get vaccinated, you have to avoid risky food and drinks. Okay, let's see about food and drinks. Here is a motto: boil it, cook it, peel it, or forget it. You have to boil, cook, peel. Boiling, it has to be rolling boil for 1 minute. Rolling boil for 1 minute before you drink water. Or otherwise, you can drink bottled carbonated water. If you want to have cold drinks, better to avoid ice. If ice is made from bottled or boiled water, then it is quite safe. Otherwise, it is better to avoid ice. And you have to avoid also popsicles and flavored ice. If you are going to have food, you should eat thoroughly cooked food. Thoroughly mean it should be hot, it should be steamed food. Vegetables like this are very difficult to clean because it has layers and layers. Better to avoid this kind of raw vegetables. Fruits that cannot be peeled. If you are going to have raw vegetable like this, it is very difficult to clean, so there can be some contamination. So better to avoid this kind of vegetables. And then fruits that cannot be peeled. Peeling. When you eat raw fruit or vegetables that can be peeled, please peel them yourself. Don't try to get ready-made one. Wash your hands with soap first and then peel. Do not eat the peelings. Sometimes girls prefer to eat all these things. So please avoid that. Better to avoid foods and beverages from street vendors, especially when you are traveling. Because for street foods, they cannot guarantee for full hygiene. Sometimes if you are traveling, this is very easily accessible and you prefer to get this kind of food, but in these days, better to avoid food from the street vendors. This is the second option, vaccination. In Malaysia, all food handlers are recommended for the routine typhoid vaccination. That is for the authorized restaurant and the food stalls. From there, you can check their ID if they get full typhoid vaccination. But most of the food handlers in the street shop, I don't think they already got vaccination. So better to have food from the authorized food stall and restaurants. So who is recommended for vaccination? Travelers, especially travelers to parts of the world where typhoid is common, like Asian countries. Even though you got vaccination, it is not 100% effective. It is not a substitute for being careful about what you eat or drink. Okay, so together with vaccination, you have to avoid unhygienic food. And another category is people in close contact with a typhoid carrier. If your family member got typhoid infection, then you have to get vaccination. And vaccination is also recommended for the laboratory workers, especially who are dealing with Salmonella typhi bacteria. Once you get vaccinated, effect doesn't come immediately. So if you are planning to travel somewhere else, better to complete your vaccination at least 1 to 2 weeks. That is depending on your vaccine type. So you have to ask your health personnel before you are traveling. Better to complete your full course of vaccination 1 to 2 weeks before traveling time. If you get vaccination long time ago, then you also need to check with your doctor, because typhoid vaccine lost effectiveness after several years. It is not safe enough. If you were vaccinated in the past, check with your doctor to see if it is time for a booster vaccination. Booster means after 3 years, after 5 years, sometimes we need to get one more shot. There are 2 vaccine types. Both are available in Malaysia. One is inactivated kill vaccine. It is given by short injection. It is lasting 2 to 3 years. Another form is a live attenuated vaccine. It can be taken orally by mouth. Very easy one. It is lasting 5 to 7 years, longer lifespan. So the best way is you have to discuss with your healthcare provider. Depending on your age, depending on your immunity, the vaccine choice is different. So better to consult with a doctor before you get vaccinated. This is summary of my topics. Typhoid fever is caused by Salmonella typhi bacteria. It is contracted by injection of contaminated food or water. How can we diagnose this? Mainly by stool culture. It is treated with antibiotics, chloramphenicol. Symptoms are poor appetite, headaches, generalized aches and pains, fever and lethargy. Lethargy means weakness. 3% to 5% of patients can become carrier. Prevention is mainly avoiding contaminated food and drinks, and it can be prevented by vaccination.